Well, my role is to be kind of the captain of the patient during the surgery while you're focused on creating the best possible outcome cosmetically. My job is to keep the patient asleep, comfortable, make sure they wake up nice and smooth. We give medications throughout the entire surgery to make sure the patient is not experiencing pain, anti-nausea medicine to prevent the chance of nausea afterwards. Still can happen, but we do our best job to prevent that and make sure they have a smooth wake up and a good experience overall.
All right, Dr. White, what about not eating, not drinking before surgery? Why is that important?
That's a very good question. So a lot of people come with the assumption that, they told me not to eat or drink because they don't want me to get nauseated after I wake up from the anesthesia. And that's partly true, and we definitely don't want our patients being nauseated, and we take a lot of measures to prevent that. But the real reason is our guidelines all state, first of all, nothing to eat or drink. We'll start with drinking 2 hours before with clear liquids. Any liquids that have fiber in it, like orange juice with pulp, or thick milk, anything creamy, that's 6 hours before. A light meal is, we don't want you to have anything to eat or drink for 6 hours as well. And a heavy meal, like steak and eggs, would be at least 8 hours or longer without eating that meal before surgery. And the reason is, anytime you eat or drink something, put something into your stomach will produce a decent amount of stomach acid. And why is that a problem? Well, when we put you to sleep, your gag or coughing reflexes are also put to sleep. So normally, if you have a little acid reflux go up into your mouth, you kind of clear your throat, cough it up, and swallow it back down into your stomach. Under anesthesia, if you have acid, a high level of acid in your stomach, and it goes up into your mouth, you're not able to cough that up and swallow it back down. And it's a small risk, but there is a potential risk of that acid solution dripping down into your lungs, and it can cause some damage, some chemical pneumonitis it's called. It's almost like burning in your lungs, and that can make some people very sick depending on what level they aspirate. So we take the measures of following. NPO means nothing to eat after whichever time we're discussing, and that will prevent and definitely dramatically reduce the risk of that from occurring. Yeah. So we take these safety measures, which have been proven over years and years.
Right. So now you get in a car accident, you go to the hospital, and they got to put you out of sleep right away. They're just going to go ahead and do it, but there's a whole different approach, and it's higher risk. So we don't want to take those risks.
Absolutely. So by following these NPO guidelines of avoiding liquids and solid food before surgery, will greatly, dramatically reduce those risks.
But what are the other medical things? I made a list so we make sure we covered them all. But as you think of medical things, what are medical things that are important to patient's history, family history?
Well, I mean, there's medical conditions that people live with every day. They've got asthma. We want to know if you have asthma.
Sure.
We want to know if you have sleep apnea and you have to use, a CPAP machine at night. We want to know if you have high blood pressure that you need to take medications for. We want to know if you've got borderline diabetes or if you do have diabetes. We really want to know if you smoke. And we also want to know if, we are in Colorado, we want to know if you smoke marijuana. Those are kind of some things that help us know how we want to care for you, a little bit differently.
Yeah, the marijuana and alcohol thing is we're not trying to say there's something wrong with you if you smoke marijuana or if you have a drink, but it may impact your anesthesia, and it may. So Jen is super skillful. All the anesthesia providers we work with are very professional, and the reason this is an exciting and I think challenging field is everybody is going to react a bit differently to the medications. So the medications we use to induce anesthesia, there's a wide range of the amount of medication it's going to take to get you effectively off to sleep. And if we have some clue that, it makes sense, maybe they drink some, or maybe they use some marijuana, it makes sense they might need a little more. Otherwise, we're flying blind. Our anesthesia providers are flying blind and saying, wow, I've got to use a lot of medication. I don't have any indication as to why that might be. We're still going to take care of you. It probably isn't going to cause any major issues, but for the smoothness of your surgery and for the kindness to your medical treatment providers, be straightforward with all of that. And we don't want you to judge what we should know and shouldn't know. So the things we're talking about are all important. Diabetes, sure, that's going to be a big deal, mainly for me, for wound healing issues. And certainly if there's insulin-dependent diabetes or things where your blood sugar could really spike, those are very important considerations. We adjust medications, we adjust food, and we want to know about so we can do intraoperative testing for diabetes. Breathing issues, so someone who has asthma, generally not a big issue. We have you bring your asthma medications.
Right. But there's some medicines that we avoid giving you in the operating room because you do have asthma.
And so that the asthma medicines will work at the appropriate place in the lungs.
Correct.
Right.
Correct.
So those are important considerations for us to be able to best and most effectively have our options available to us in selecting how we're going to treat you for under anesthesia.
Right.
And then sleep apnea is another important one. That's one that if you have ridiculously loud snoring, if you're very tired during the day, you may have undiagnosed sleep apnea. There are body types where we may suspect if someone is very significantly overweight, classically that's someone that's going to be at high risk of sleep apnea. But there are people that have that are rail thin that have sleep apnea. So if you have a history of sleep apnea, that's an important one that we're going to want to know about for your surgery, and just let us know. All right, so we head on back.
And this is not what the OR would technically look like because we have been in here all day and it needs to be cleaned tonight. But your table would be here and you would get on the table. And then this is what your anesthesia provider is going to be using. So we've got...
Now, one difference is often we'll have the lights down and just have the incandescents on.
Yeah.
And we'll have some really mellow jazz or reggae, or sometimes a little rock and roll, right?
If I had it my way, we would be listening to country.
Or country.
We have standard monitors that everybody uses in an operating room, so you shouldn't expect anything different. And then we've got this machine, and the machine consists of a breathing component to it, our ability to deliver oxygen and air, and our ability to deliver inhalational agents. And then if I would choose not to do an inhalational agent, we have a little machine down here that's going to let me do IV.
We're going to wind it down for tonight. Please follow us as well on Snapchat, Instagram, Facebook at DenverBodyDoc, our website, coloradoplasticsurgery.com. I'm Nick Slenkovich. We love to partner with patients on their self-improvement journey. Plastic surgery is never the destination. It can be part of the journey for some. For Nick, myself, Austin, Alex, Clayton, and Dan that are here tonight, as well as the rest of our team here at Colorado Plastic Surgery Center. Thank you. Enjoy your journey and good night.